Gano, Sego. Hello, everyone. This is your COVID-19 podcast for the week of July 27th, 2020. My name is Lori Davis Hill, Director of Health Services and Incident Command for the current pandemic response here at Six Nations. We are approaching 140 days since we declared a state of emergency. Let's look over to our wellness area, which is where it all starts. Everyone, please welcome for a podcast visit, complete with some wellness tips. Here is Brody Thomas, manager of the mental health and addictions team. And Brody's here today to share his experience with COVID 19. Welcome, Brody.
Thank you, Laurie. It's always a pleasure to be here.
Can you just let the audience know what your experience has been with COVID 19?
Yes, I certainly can. So I guess I wanted to start by letting everyone know that I did have COVID-19. Um, and I wanted to begin with talking a little bit about contracting COVID-19 and some of the assumptions that some people can tend to make when someone is tested positive. And I want to say that, no matter how much distancing and hand sanitization and all the other practices, which are great, they're very preventative, that sometimes it just still happens that for whatever reason you're in proximity and you didn't know whether you're at the grocery store getting groceries or Walmart getting something you needed, that it just happens that way. A lot of people at times, don't have symptoms and you could come into contact that way. So I guess that's where I wanted to start, because I know in my case, I was practicing social distancing and only going out for what I needed, like I've heard a lot of people do, but I still somehow it snuck in, and I still ended up testing positive. And I know when I did test positive, and this is a small community, and it seemed to spread pretty quick that there was someone with my name that had it, and I was receiving random messages on Facebook, and people had my number somehow that I didn't know and were calling me, asking me. And, I wanted to, I guess, let people know that that gossip piece doesn't really help in those situations, especially when someone is sick and it is serious. It's hard to hear some of the gossip and rumors going around in the community. So that's kind of the start of how it happened. And it was unfortunate. I did do 21 days in isolation in total, and that's kind of the next part I wanted to talk about, was the actual experience of having the illness and being in the home for that extended period of time. So like I said, I did 21 days in total, and a lot of people have asked me, the first thing they say, well, how was it? I'm like, what kind of, were you really sick? What was it like? I'm still getting questions to this day about what it was like, and I don't mind answering them, which is why I'm doing this podcast. But so I guess I'll start. It started like a flu. I had chills, fever, all of a sudden. But a little bit before that, maybe a little like really tired, quick, fatigued, and then like I said, came down with a fever in the middle of the night. And that lasted about 2 to 3 days, having those flu-like symptoms. And after those, the fever broke. I ended up getting a chest cough, like a really dry, deep chest cough. And that was kind of the scary part for me, was having those real deep coughs, and nothing's coming out, and the shortness of breath and all those things. And the nurse that was checking in with me a couple times a day continually asked me, if you're really having trouble breathing, or if it gets worse, you need to call 911. And there was a few times where in the middle of the night where I just kept coughing and I couldn't really breathe too great, that I was close to calling 911, and that was scary. It's kind of like the next level, having to go into the hospital, and so that definitely was a little bit scary. But after the cough broke, after about 7 or 8 days, I slowly started to feel better physically anyways. So about 12 days in total, I think, was for the illness to start to leave the body. One big help that I want to mention was I did receive some traditional medicine from one of our grandmothers, and it was like a tea. And after taking that, the first time I took it, it kind of, I don't know how to describe it other than it like kind of stirred it up. It almost made me worse for the first time, for the first day, and it kind of scared me. I don't want to take this because it's going to make it worse. But they were persistent and told me to keep trying it, so I did. And that's kind of when I started to feel better, those second and third days after taking that traditional medicine that was brought to me. So I wanted to let people know about that too. So I guess the other part, besides the actual physical illness, was just the mental and spiritual impact of being in the house for 14 days was very different. I don't know if anyone else out there likes to see their mom and family when they're sick, or their partner, they make them soup and grilled cheese and all that stuff. But you're on your own in this case, and it's definitely a different feeling, being isolated and sick. And a lot of the messaging you can't help but read on Facebook or the news was, updated reports with death tolls and all these other statistics that you can't help but go into those dark places sometimes and think, am I going to be a statistic next? Am I going to be, the next death case that's going to happen? And that's scary. And it was a very big help having the nurse call each day and check in. I'll admit at the start it was a little bit frustrating doing the contact tracing and trying to remember a week or 2 weeks of everywhere you've been and who you've been in contact with. But it's especially hard when you're very ill and irritable and not able to take deep breaths, but you're being questioned. You just want to kind of get your rest and all that. But it was nice. Shout out to my nurse. I won't say her name, but she did call every day, and I was probably grumpy with her a few times, but she kept calling, so that was nice. But I guess I'm very appreciative that I did have this experience now. I'm trying to use it to I guess better support future cases if we do have some of the gaps that I noticed. I was on the emergency control group for a bit. I've been working frontline in mental health and addictions since this started in March. And then I went all the way to being a positive case on the other end of things. So I've seen it from a lot of different angles. And I'm using that to better service, I guess, any future cases that we might have.
Any other ways that this COVID-19 experience has shaped or changed your outlook on work or life, or the balance of those two things?
For sure, yeah. It definitely changed my perspective on COVID. I know a lot of people there's a lot of rumors it doesn't actually exist, or it's not a real thing, or it's not that bad, or I can't catch it because I'm in good shape, or all these things. And I'm not saying I'm in perfect shape, but I'm 36 years old and caught it, and it was really hard on my body. It was bad, and it's a real thing. And encourage everyone to do what they can, wear their mask, distance, hand sanitize, just try to not take those risks. And I know there's tons of messaging out there, that we're doing it for the community, and I really believe that. As far as life perspective, a lot of people have said, well, I was really worried about you, and I didn't want to say anything because we wasn't sure, that it was you. So, but I told them, well, don't be sorry. It's okay. If you were thinking about me and putting those messages out there, out to me to get well, then that's great. I did have one small story. My uncle, he came and cut my grass, and just doing something like that, like seeing your family out there, cutting your grass. I don't know if he just didn't like the way it looked or if he was doing it for me, but that was really nice just to look out the window and see, families pulling together and doing those things. I had all kinds of people drop food off and water and Gatorade and asking me what I needed. And a lot of people that did know in my circle that it was me reached out, which is great. And like any time you get really ill, you are thankful to see the next day. And I'm just happy that I can share the story now.
Well, it's been a pleasure talking to you about your experience today, Brody. I know each individual will have a unique experience, but it is really important to share this information. So we need to learn better ways to respond and to continue to support our community. So it's also good to hear that you did feel supported during those days. So I hope that you do stay well. I know I've seen some long-term effects that people have experienced. So, I'm happy to hear that you're doing well. So now again.
Yeah, well, Laurie, thanks.
Okay, now let's move from wellness to numbers. Over the weekend, the province moved from even more areas to stage 3 of reopening the provincial economy, and the numbers recorded were fluctuating over the past week. Update to the current state in Ontario, we have 38,799 total cases of COVID-19 reported. Of those, 34,461 are resolved, and there have been 2,764 deaths, and that indicates a 7% death rate. There are currently 1,574 active cases. Of those, 82 are currently hospitalized, 30 are in the intensive care unit, and 18 of those 30 are in intensive care on a ventilator. Here at Six Nations, the report is a total of 15 cases of COVID-19 since March 12, 2020. We currently have no active cases. Of those positives, 14 have now resolved with one death. And looking at our testing numbers, 1,285 people have been tested. And of those tests conducted, 1,174 results have been negative. We have yet to hear back from the lab on 96 test results. And Oswego Public Health currently has 63 people in self-isolation. Over to our adjacent communities, Mississaugas of the Credit remains at one resolved case. Haldimand Norfolk Public Health Unit has 455 total cases, 28 are active, 395 are recovered, and 32 deaths. Brant Public Health Unit reports 139 positive cases, 5 are active, 130 are resolved, and 4 deaths. Hamilton Public Health Unit reports 887 total cases, 17 are active, 825 are resolved, and 45 deaths. And the Toronto Public Health Unit reports 15,274 cases, 462 are active, 13,668 are resolved, and there have been 1,144 deaths. Stage 3 is well underway in Ontario, but here in Six Nations, we are maintaining Stage 2 for the time being. We want to be sure we are watching what is happening here on the territory and in the surrounding communities and not wanting to move too quickly. We know there are concerns with cross-border travel, and here is an excerpt from a notice with respect to this issue. The U.S. is currently experiencing a very high number of COVID-19 cases. Crossing the border can put you, your family, and our community at risk of getting COVID-19. If you must cross the border, consider the following. Before someone crosses into Canada, they must be able to stay in Canada for a minimum of 15 days as required for self-isolation. You need to make arrangements ahead of time to have a suitable place to quarantine for 14 days upon entry, where you will have access to basic necessities, food and medication, and will not have contact with vulnerable people, adults age 65 or over, people with pre-existing medical conditions, or those who are immunocompromised. If you do not have a suitable place to quarantine for 14 days, you can call Oswego Public Health or the COVID-19 Assessment Centre to make arrangements prior to entering Canada. Then, when you cross the border into Canada, please carry documentation showing that you are a community member of Six Nations. That's a Haudenosaunee passport, status card, birth certificate for a child age 15 or younger. Call Oswego Public Health at 519-445-2672 or the Six Nations Information and Assessment Center at 1-855-977-7737 or at 226-446-9909 when entering Canada. It is important that you drive straight to the place where you are being quarantined and self-isolate for the 14 days. You could have the virus without knowing that you do. The COVID-19 hotline remains open during July and August for the Assessment Center. And again, the Six Nations COVID-19 Assessment Center numbers are 226-446-9909 or toll free at 1-855-977-7737. You can call the hotline and book your test. You can be tested with or without symptoms. Call anytime if you have questions or concerns. In order to continue with Project Protect Our People, on July 24th, Six Nations adopted mandatory face coverings in all public indoor spaces and ride services. To implement the new rule, public education activities will be launched, which will encourage residents and businesses to wear face coverings when in public spaces. Signs will also be erected on the borders of Six Nations of the Grand River Territory, advising visitors to the community of the requirement to wear face coverings. Community members looking to donate homemade masks, please contact Six Nations of the Grand River Public Works at 519-445-4242 during business hours, Monday to Friday, 8:30 to 4:30 p.m. Exceptions to the face covering rule include children under the age of 2, individuals with medical conditions that make it difficult to wear a mask, persons who are unable to put on, adjust, or remove a mask without assistance, businesses not open to the public, and where you're able to physically distance in the workplace with those who are not members of the same household, and employees who are behind a physical barrier. The requirement to wear face coverings is effective immediately until August 30th, 2020, at which time it will be reassessed and a further decision made. More updates on this matter will be forthcoming. You can find information on face covering at our website, www.sixnationscovid19.ca. And further, you can watch Healthy Six and Six Nations Matters for ongoing online virtual Zoom program being announced for the summer. And if you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204, and that's available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 p.m. at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4, and that can be found on the Six Nations COVID-19.ca website. I do want to remind everyone again that the world remains in the midst of a global pandemic. As previously mentioned, if you visit or live at Six Nations, let's stay healthy and moving forward by wearing a mask in public, keep physical distancing 6 feet apart, wash your hands frequently, clean high-touch areas often. And for our visitors from outside Canada, please quarantine for 14 days, even if you are from Six Nations and only visited the U.S. on a day trip. Remember our frontline workers here on Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.